What do we have?
Stabilized a sucking chest wound, possible GSW to the abdomen. BP is 80 over palp.
Vitals look bad, let's move!
The operating room doors slammed open. Who authorized her to be here? The voice cut through the sterile air like a blade. Captain Reynolds stood near the surgical table, his gloves already stained. His eyes burned with irritation as he pointed across the room. At ease. No, not even close, he snapped. This is a military operating theater, not a training classroom. Across from him, the rookie nurse didn't move. She stood perfectly still beside the instrument tray, her posture straight, hands steady. "Sir, the surgical team is short one nurse," she said calmly. Reynolds scoffed. "You. Fill that role." He shook his head and turned to the others. "Who signed off on this?" No one answered. The heart monitor beside the patient gave a sharp, uneven beep. Reynolds swore under his breath and stepped closer to her. "Listen carefully," he said, lowering his voice but sharpening every word. "There are men bleeding out in this hospital who actually deserve experienced hands. Not someone fresh out of training." The room fell silent. Even the anesthesiologist glanced up. The young nurse didn't react. Her eyes remained on the patient. "Sir," she said quietly, "the patient's blood pressure is dropping." Reynolds didn't even look at the monitor. "Stay in your lane, nurse." Another sharp beep. The surgeon across the table hesitated. "Captain, she might be right." Reynolds turned, furious. "Did I ask for commentary?" The tension in the room tightened like a wire ready to snap. Outside the operating room window, two Marines watched through the glass, their faces pale. Inside, the patient's breathing became shallow. The monitor spiked again. Beep, beep, beep. The rookie nurse took one small step toward the surgical table. Reynolds immediately blocked her path. "I gave you an order," he said coldly. For a moment, neither of them moved. The operating room seemed to hold its breath. Then the nurse looked directly at him. Not nervous. Not intimidated. Just steady. "Sir," she said, her voice calm but firm. "If we don't move now, he dies." Captain Reynolds didn't move. For half a second, the operating room existed in a strange kind of suspension, the steady whine of machines, the faint hum of overhead lights, the quiet breathing of the anesthesiologist behind the curtain. Then Reynolds exhaled slowly. "Step back," he said. The rookie nurse held his gaze a moment longer, not challenging him. Not apologizing either. Just waiting. Finally, she stepped away from the table. Reynolds turned back to the patient as if the interruption had never happened. Scalpel. A gloved hand immediately placed the instrument into his palm. The surgical team moved with the silent precision of people who had worked together under pressure before. Boots squeaked softly against the polished hospital floor. Stainless steel tools clicked against trays. The man on the table was a Marine. 23 years old. Shrapnel wound through the lower abdomen from an IED outside Kandahar less than 10 hours earlier. Evac flight. Field stabilization. Then rushed straight into the surgical wing at the military hospital. Now his life balanced on thin lines of oxygen and electricity. The monitors stuttered again. Beep, beep. Reynolds leaned closer to the incision site, his voice controlled. Suction. The nurse beside him moved instantly. Across the room, the rookie stood near the supply cart, silent again. Invisible now that Reynolds had decided she should be. Most new nurses didn't last long in a military surgical unit. The pace broke them. The hierarchy crushed them. Orders came fast, sharp, and often in front of an audience. Mistakes weren't corrected gently. They were cut down immediately, the way discipline worked everywhere else in the service. Especially here. This hospital treated the worst injuries coming out of combat zones. Every minute mattered. Every decision could be the difference between a folded flag and a living Marine. Reynolds had earned his reputation the hard way. 12 years in uniform. 3 combat deployments attached to forward surgical teams. He was known for being brilliant in the operating room and impossible outside of it. The staff respected his skill. They also avoided his temper. The anesthesiologist glanced briefly toward the rookie nurse near the cart. She hadn't spoken again. Hadn't fidgeted either. Just watched the monitors. Beep. Beep. Reynolds' voice cut through the room again. Clamp. Metal clicked. He worked fast, controlled movements guided by muscle memory built from hundreds of surgeries. Outside the operating room window, 2 Marines still stood watching through the glass panel. Their uniforms were dusty from travel. One had his arms crossed tightly. Neither spoke. Inside, the rookie nurse quietly moved a tray 2 inches to the left, aligning it with the surgeon's reach. No one noticed except the circulating nurse. A small adjustment, but a precise one. Reynolds continued working, his attention fixed entirely on the wound. Blood pressure. Dropping slightly, the anesthesiologist replied. Reynolds muttered something under his breath. Figures. He didn't look at the rookie again. In his mind, she had already been categorized. New. Inexperienced. A distraction he didn't have time for. Military hospitals ran on order and trust. You trusted the person beside you to know their job, to follow commands, to stay exactly where they belonged. And in Reynolds' view, the young nurse by the supply cart hadn't earned that place yet. The monitor gave another uneven tone. Beep, beep. The circulating nurse frowned slightly. Across the room, the rookie nurse's eyes narrowed just a fraction. She stepped closer to the monitors again. Not close enough to interrupt. Just close enough to see clearly. Her voice, when it came, stayed careful. Respectful. Captain, his pulse pressure is narrowing. Reynolds didn't look up. Noted. But the anesthesiologist shifted slightly behind the drape. He looked at the screen, then back at the surgical field. Something about the rhythm felt off. Outside the glass, the 2 Marines leaned forward. Inside the room, the air seemed to tighten again. Reynolds kept working, but the rookie nurse kept watching the monitor. And for the first time since the surgery began, the silence inside the operating room didn't feel controlled anymore. It felt like the beginning of a problem no one had noticed. The heart monitor skipped again. Beep, beep. The pause between the tones stretched longer than it should have. Across the room, the rookie nurse shifted closer to the monitor screen. Her eyes scanned the numbers quickly, silently. Captain Reynolds didn't even look up. I already told you, he snapped. Stay in your lane. His voice carried across the entire operating room. 2 nurses at the instrument table froze for half a second. The anesthesiologist kept his eyes on the oxygen levels, but said nothing. The rookie nurse stopped where she was. Reynolds finally glanced up, irritation flashing across his face. Do you need the order repeated? No, sir, she answered quietly. Good. He turned back to the surgical field. Retractor. Metal slid into his waiting hand. The room returned to its tense rhythm. Tools clinked. The suction tube hummed softly. The patient's breathing moved through the ventilator in mechanical bursts. But the monitor continued its uneven pattern. Beep. Beep. The anesthesiologist cleared his throat slightly. Captain, his pressure, I can see the pressure, Reynolds cut in. His tone hardened. We stabilize the bleed first. The anesthesiologist leaned back again. Across the room, the rookie nurse folded her hands behind her back, the way junior staff often did when trying to remain invisible. But her eyes never left the monitor. Another pause. Beep. The circulating nurse shifted nervously. Reynolds noticed. He straightened slightly, scanning the room. What is it with everyone today? He said sharply. Did discipline disappear overnight? No one answered. His gaze landed on the rookie again. You're making the whole team nervous hovering like that. I'm monitoring the patient, sir. Reynolds gave a short laugh. You're observing. Monitoring requires experience. A few of the staff exchanged brief glances. No one spoke. The rookie nurse remained still. Reynolds stepped back from the table just enough to face her fully. Let's make something clear, he said, loud enough for everyone in the room to hear. You are here to assist the circulating nurse. Nothing more. Yes, sir. Which means you don't interrupt surgical decisions. You don't second-guess the operating surgeon. The room had gone completely quiet. Even the ventilator seemed louder now. Reynolds gestured toward the door with his elbow. If you feel overwhelmed, you can step outside. Nobody will hold it against you. The comment hung in the air. The anesthesiologist looked down at the monitor again. Beep. The rookie nurse didn't move. Instead, she glanced once more at the numbers scrolling across the screen, then at the patient, then back at Reynolds. Her voice remained calm. "Sir, the heart rhythm is changing." Reynolds turned slowly. This time his patience was visibly gone. "I am aware of the heart rhythm." He stepped closer to her, lowering his voice just enough to make the room lean in. "You're not the only person here who can read a monitor." "Yes, sir." "Then act like it." The rookie nurse nodded once. But she didn't step away from the screen. The anesthesiologist shifted again, clearly uneasy now. He looked at Reynolds. "Captain, her observation might be..." Reynolds raised a gloved hand without turning. "That will be enough." The words landed like a command. Silence returned instantly. Across the glass window outside the operating room, the two Marines watching had moved closer. One pressed his hand against the glass. Inside, the monitor tones stretched again. Beep. The rookie nurse's posture tightened almost imperceptibly. She took one small breath. Then another. Reynolds had already turned back to the surgical field. "Clamp," he ordered. The instrument was placed into his hand. Metal touched metal. The room moved again. But the tension hadn't left. It had only shifted. And somewhere beneath the sound of machines and controlled voices, something was beginning to go wrong. The rookie nurse could see it. The anesthesiologist could feel it. But the man with the authority to stop everything had already made it clear no one else was allowed to speak. And yet, the operating room settled into a tense rhythm again. Metal touched metal. Gloves brushed against stainless steel trays. The ventilator pushed air into the Marine's lungs in steady mechanical bursts. But the monitor still sounded wrong. Beep, beep. The gap between each tone stretched a little longer every time. Captain Reynolds leaned deeper over the surgical field, his shoulders tight with concentration. Suction. The tube moved instantly. A nurse adjusted the overhead light, flooding the wound with harsh white clarity. Reynolds worked quickly now. His movements were sharp, efficient, practiced. 12 years of surgeries had trained his hands to move without hesitation. But something in the room had shifted. The circulating nurse noticed it first. Not in anything obvious. Just small things. The anesthesiologist checking the monitor more often than usual. The instrument nurse holding tools a second longer before passing them. The rookie nurse standing near the screen, perfectly still. Watching. The monitor chirped again. Beep. Reynolds spoke without looking up. Pressure. 80/50, the anesthesiologist replied. Reynolds exhaled slowly. Lower than I'd like. He kept working. Outside the glass window, the two Marines were still there. They hadn't moved in several minutes. One of them leaned his forehead briefly against the glass before straightening again. Inside, the rookie nurse stepped half a pace closer to the monitor. Not enough to draw attention. Just enough to see the waveform clearly. Her eyes followed the rhythm. Then the numbers. Then the rhythm again. A slight crease formed between her brows. She said nothing. Reynolds reached out. Retractor. The instrument landed in his hand. Metal shifted. Another thin line of blood appeared before suction cleared it away. Across the room, the anesthesiologist adjusted the flow. His voice stayed controlled. Heart rate dropping slightly. Reynolds didn't respond. Instead, he leaned closer to the incision. The rookie nurse looked again at the monitor. Beep. Her fingers moved slightly against the edge of the supply cart. Not nervous. Calculating. She glanced briefly toward the anesthesiologist. Their eyes met for half a second. He looked back at the monitor. Then away again. The exchange was small. Almost invisible. But the circulating nurse noticed. The room felt quieter now. Even though the machines were still humming. The rookie nurse spoke again, carefully choosing her words. Sir, the rhythm is becoming irregular. Reynolds didn't stop working. I've seen irregular before. Yes, sir. He finally glanced at the monitor. Just a quick look. Then back to the surgical field. Nothing critical yet. The anesthesiologist didn't answer. But his hand hovered closer to the medication tray. Outside the glass, one of the Marines tapped lightly against the window. The circulating nurse noticed that too. She stepped toward the door, peeking through the small side panel. When she returned, her face looked tighter. Reynolds caught the movement. "What now?" "Family liaison outside, sir." Reynolds muttered something under his breath. "Of course there is." He focused back on the incision. "Clamp." The instrument nurse passed it forward. Reynolds' hands moved faster now. The rookie nurse studied the monitor again. Beep. Beep. Then a slightly longer pause. Her eyes shifted to the oxygen saturation reading. Then to the blood pressure. Then back to the heart rhythm. She inhaled quietly. The anesthesiologist noticed. "What do you see?" he murmured, almost under his breath. The rookie nurse answered just as quietly. "Pattern change." The words were barely audible. Reynolds' head lifted slightly. "What was that?" Neither of them responded immediately. The anesthesiologist cleared his throat. "Nothing, Captain." Reynolds stared at them for a moment, then turned back to the patient. But his movements had slowed slightly now. The room's tension pressed closer. The instrument nurse wiped sweat from her forehead with her shoulder. The circulating nurse adjusted the light again even though it didn't need adjusting. The rookie nurse stepped closer to the monitor one more time. Her voice stayed calm. "Sir, the interval spacing is widening." Reynolds' patience snapped again. "I said I see it." "Yes, sir." The monitor beeped again. But the tone sounded thinner now. Outside the glass window, one of the Marines suddenly straightened. Inside the room, the anesthesiologist leaned forward. "Captain." Reynolds looked up sharply. "What?" The anesthesiologist hesitated. Just long enough for another uneven tone to echo through the room. Beep. Then silence for 2 seconds. 3. The rookie nurse took one step forward. Her posture changed slightly. Less tentative. More certain. The anesthesiologist noticed that immediately. Reynolds noticed it too. His voice hardened. "I thought we were done interrupting." The rookie nurse didn't answer right away. Her eyes remained on the monitor. Another long pause stretched across the room. Then beep. The anesthesiologist's hand moved closer to the emergency medications. The circulating nurse glanced at the door again. Outside, the 2 Marines were standing perfectly still now. Inside the operating room, the tension had stopped feeling like routine pressure. It felt like something building. Something the machines were already warning about. But no one had said it out loud yet. The pause between heartbeats stretched again. Beep. Silence filled the operating room for a long second. Then beep. The anesthesiologist leaned forward slightly, eyes narrowing at the monitor. "Captain, pressure is 70. Reynolds didn't answer immediately. His focus stayed on the surgical field, shoulders tense as he worked deeper into the wound. "Suction," he ordered. The tube slid forward. Dark red vanished into the container with a low hiss. Across the room, the rookie nurse stepped closer to the monitor. This time no one told her to stop. Her eyes followed the waveform carefully. The rhythm wasn't just slowing. It was shifting. She tilted her head slightly, studying the pattern the way someone studies a map. Beep. The anesthesiologist spoke again, quieter now. Heart rate 48. Reynolds muttered under his breath. "Damn it." He adjusted the clamp, leaning closer to the incision. The instrument nurse handed him another tool without being asked. Across the glass outside, one of the Marines placed his hand flat against the window. Inside the room, the rookie nurse's gaze flicked briefly to the foreline, then to the monitor again, then to the patient. She stepped toward the anesthesiologist. Slow, careful, not interrupting, just close enough to see his panel clearly. The anesthesiologist noticed. "What do you see?" he murmured quietly. The rookie nurse didn't answer right away. Her eyes moved across the screen again. Beep. The waveform dipped in an uneven curve. Her fingers hovered just above the edge of the monitor stand. Not touching, just measuring. Reynolds spoke sharply from the table. "Blood pressure update. 68/40, the anesthesiologist replied. A quiet tension moved through the staff. The instrument nurse shifted her weight. The circulating nurse checked the supply cart even though nothing was missing. The rookie nurse looked again at the rhythm. Something about the spacing. Something about the shape. The pattern repeated, then repeated again. She inhaled slowly. Her voice stayed controlled. Sir, that rhythm. Reynolds cut her off instantly. I said I'm aware. Yes, sir. But she didn't step away this time. Instead, she looked toward the medication tray. Then back to the monitor. Then toward the anesthesiologist. A subtle glance. The anesthesiologist followed her eyes. Then he looked back at the waveform. His expression tightened. Captain, Reynolds didn't look up. What? The anesthesiologist hesitated. Rhythm may be progressing. Reynolds finally glanced at the screen. Only for a second. Then he turned back to the surgical field. We're stabilizing the bleed. That's priority 1. The rookie nurse spoke again, softer now. Sir, the interval length is consistent. Reynolds straightened slightly. What does that mean? The question sounded more irritated than curious. The rookie nurse didn't answer immediately. Instead, she pointed carefully toward the monitor. Not touching it. Just indicating the waveform. Look at the spacing. The anesthesiologist leaned closer. Reynolds frowned but followed the direction. The rhythm appeared slow, but not random. Beep, beep. A steady distance between each signal. The rookie nurse's voice stayed calm. It's not deterioration. The anesthesiologist's eyebrows rose slightly. Reynolds glanced at her again. Then what is it? For a moment, she didn't answer. Instead, she studied the waveform once more. Her eyes moved with quiet precision. The anesthesiologist watched her carefully now. Not the monitor. Her. Because she wasn't reacting like a junior nurse anymore. No uncertainty. No hesitation. Just analysis. Outside the glass window, the Marines exchanged a quick look. Inside the room, the rookie nurse leaned slightly closer to the screen. Her finger hovered near the waveform. Again, she didn't touch it. Just traced the rhythm in the air. Beep. See the dip, she said quietly. The anesthesiologist nodded slowly. Reynolds folded his arms briefly, watching. And the recovery slope, she added. Another pause. Beep. The anesthesiologist's expression changed. Not panic. Recognition. He looked at her again. Where did you learn to read rhythms like that? The rookie nurse didn't answer the question. Instead, she looked toward the patient. Then toward the 4-line. Then back to the monitor. Sir, she said calmly. If I'm right, the heart isn't failing. Reynolds stared at her. Then explained the numbers. She held his gaze for the first time since the surgery began. Still respectful, but certain. I think it's compensating. The room went quiet. The anesthesiologist looked back at the screen again. The waveform dipped once more, then recovered. Beep. His hand slowly moved away from the emergency medication tray. Reynolds frowned. You're saying this is stable? The rookie nurse didn't nod. She simply watched the monitor again. Studying. Calculating. Then she spoke carefully. No, sir. Another long pause passed through the operating room. The machine beeped again. Beep. The rookie nurse's voice stayed calm. But it's not what you think it is either. Reynolds stared at her. For the first time since she entered the room. He didn't interrupt. The monitor beeped again. Beep. The sound stretched through the operating room like a warning. Captain Reynolds stared at the screen, his patience thinning. You're telling me it's not deterioration, he said, voice tight. But it's not stable either. The rookie nurse didn't answer immediately. Her eyes moved once more across the waveform. Then to the Marine on the table. Then to the 4-pump. Finally, she spoke. Sir, the heart isn't failing. Reynolds folded his arms. Then start explaining. She shook her head slightly. No time. That answer snapped something in him. No time. Reynolds stepped closer, his voice rising. You've spent the last 15 minutes interrupting the surgery with theories you can't even finish. The room went silent again. The anesthesiologist watched carefully now. The rookie nurse's posture didn't change. Her voice stayed level. The rhythm pattern is compensatory bradycardia. The term landed in the room like a stone. The anesthesiologist blinked once. Reynolds frowned. That's not possible. She finally looked directly at him. It is if the vagal response is being triggered by internal pressure. The anesthesiologist leaned toward the monitor again. His eyes widened slightly. Reynolds shook his head. No. We controlled the bleed. Not all of it, she said. Another beep echoed through the room. Beep. The anesthesiologist spoke quietly. Captain, look at the waveform slope. Reynolds glanced at the monitor again. The pattern repeated. Slow drop. Sharp recovery. Beep. The rookie nurse stepped forward. This time Reynolds didn't stop her. She moved to the monitor and pointed just beside the line. Every time the pressure rises here, the heart slows to compensate. The anesthesiologist nodded slowly now, which means her eyes moved to the patient's abdomen. Internal pressure building somewhere we're not looking. Reynolds stared at the surgical field, then at the monitor, then back at her. You're suggesting a secondary bleed. I'm suggesting compression. The anesthesiologist's voice came out lower now. Pericardial pressure. The rookie nurse nodded once. Reynolds' expression hardened. That's a massive assumption. She didn't argue. Instead, she stepped closer to the table. Look at the skin tone change along the rib line. The instrument nurse leaned in slightly. The anesthesiologist did too. Reynolds hesitated. Then his eyes followed her gesture. A faint discoloration just beneath the surgical drape. Subtle. But there. The anesthesiologist exhaled slowly. Oh, hell. Reynolds' jaw tightened. You're saying the shrapnel nicked higher than we thought? Yes, sir. The monitor beeped again. Beep. The anesthesiologist looked at her again. How long have you been watching that pattern? Since the first irregular interval. The room went completely still. Reynolds stared at her. You should have said something sooner. The rookie nurse met his gaze calmly. I tried. No one spoke for a moment. Then the anesthesiologist quietly said she did. The words hung heavy in the room. Outside the glass window, one of the Marines leaned closer. Inside, Reynolds turned back to the surgical field. His voice changed. Not louder, but sharper. Prep for thoracic access. The instrument nurse moved instantly. The circulating nurse stepped toward the supply cabinet. The entire room shifted gears. Reynolds worked quickly now, cutting higher along the rib margin. Seconds passed. Then suction filled with darker blood. The anesthesiologist's voice rose slightly. There it is. Pressure on the monitor began shifting immediately. Beep. Faster now. Beep. The rookie nurse adjusted the suction angle without being asked. Perfect placement. Reynolds noticed. For the first time since the surgery began, he looked at her differently. Not as a trainee. Not as a distraction. As part of the team. The anesthesiologist watched the monitor climb. Heart rate stabilizing. Reynolds sealed the vessel. Metal clicked. The bleeding slowed. Then stopped. The monitor beeped again. Beep. Steady. The tension in the room slowly released. For a moment no one spoke. Then Reynolds pulled back slightly from the table. His eyes moved to the rookie nurse. You said that rhythm pattern in under 30 seconds. She wiped her gloves lightly against a sterile towel. Yes, sir. The anesthesiologist studied her. You don't learn pattern recognition like that in basic training. She didn't answer. Reynolds' gaze narrowed. Where exactly did you train? The rookie nurse removed her gloves slowly. For a moment the room waited. Then she spoke quietly. Advanced Trauma Cardiology Fellowship. The instrument nurse blinked. The circulating nurse stopped moving. Even the anesthesiologist froze for a second. Reynolds stared at her. You're telling me a fellowship-trained specialist just walked into my operating room as a rookie nurse? She met his gaze calmly. No, sir. A small pause followed. Then she added, I was reassigned this morning. For a few seconds after the bleeding stopped, no one spoke. The only sound left in the operating room was the steady rhythm of the monitor. Beep. 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 The Marine on the table was stable now. Not safe yet, but no longer slipping away. Captain Reynolds remained standing over the surgical field, his hands resting lightly on the edge of the table. His shoulders were still tense, but the urgency in the room had changed. Controlled again. The anesthesiologist glanced at the monitor once more and then leaned back slightly. Heart rate 62, he said quietly. Pressure climbing. The instrument nurse let out a slow breath she hadn't realized she'd been holding. Across the room, the circulating nurse began updating the chart. Routine returned in small pieces. But the atmosphere had shifted. Everyone in the room was aware of it. Reynolds carefully finished the final steps of the procedure. His movements were slower now, deliberate. The surgical field was cleaned. Sutures placed. Closing, he said. The instrument nurse passed the needle driver. No one rushed. The emergency had passed, but the silence remained. The rookie nurse, no longer quite fitting that description, stood near the instrument table, hands folded lightly in front of her. She watched the patient's monitor the way she had been watching it the entire time. Quietly. Professionally. The anesthesiologist finally spoke again. "That call you made." He shook his head slightly. "Most people wouldn't have seen it." She didn't respond. Reynolds tied the final suture and stepped back. Time of stabilization, 14:32, the circulating nurse recorded. Reynolds removed his gloves slowly. The snap of latex breaking the sterile seal sounded louder than it should have. Across the glass outside the operating room, the two Marines straightened when they saw the team beginning to move away from the table. The circulating nurse walked toward the door to speak with them. Inside the room, Reynolds wiped his hands with a sterile towel. He didn't immediately look at the nurse who had just helped save the patient's life. Instead, he stared at the surgical tray for a moment. Then he finally turned. "You said you were reassigned this morning." "Yes, sir." Her tone was calm. Not defensive. Just factual. The anesthesiologist crossed his arms, still studying her. "Advanced Trauma Cardiology Fellowship," he repeated. "That's not entry-level training." "No, sir." Reynolds' expression tightened slightly. "So why are you listed as a junior nurse on my roster?" She answered without hesitation. "Administrative error during transfer, sir." The anesthesiologist let out a quiet laugh under his breath. "That's one way to start a new assignment." Reynolds didn't smile. Instead, he walked toward the monitor, studying the stabilized waveform. Beep. Beep. Even again. He stood there for several seconds. When he spoke again, his voice had changed. Not softer, but measured. "You tried to warn me." "Yes, sir." "You did warn me." Another pause. The room stayed quiet. Reynolds finally looked directly at her. "I shut you down." The statement wasn't a question. She didn't rush to answer. "Sir, you were focused on the surgical field." The anesthesiologist glanced at her, recognizing the careful choice of words. Reynolds did too. But he didn't argue with it. Outside the door, the circulating nurse was speaking quietly to the Marines. One of them nodded repeatedly. Inside the operating room, Reynolds folded his arms. "You understood the rhythm pattern before anyone else here." "Yes, sir." "How long have you been working trauma cases?" 7 years. The instrument nurse blinked slightly. Reynolds noticed. He exhaled slowly. 7 years. He glanced back at the table where the Marines still lay under anesthesia. "If you hadn't spoken up," he didn't finish the sentence. He didn't need to. The anesthesiologist looked at the stabilized monitor again. "We would have chased the wrong problem." No one disagreed. Reynolds finally stepped closer to the nurse. Not confrontational this time. Just direct. "What's your name?" "Lieutenant Harper, sir." The words landed differently in the room. The instrument nurse looked up. The anesthesiologist raised an eyebrow. Reynolds stared at her for a second. "Lieutenant." "Yes, sir." Another quiet pause followed. Outside the operating room, the Marines had stopped pacing. Inside, Reynolds gave a small nod. "Next time you see something like that," he said, "don't wait for permission." Harper didn't react immediately. Then she answered calmly. "Yes, sir." Reynolds turned back toward the patient once more. For a moment he simply watched the steady rhythm on the monitor. Beep. Beep. The room slowly returned to routine. Equipment was cleared. Charts were updated. The team prepared to transfer the Marine to recovery. But the earlier tension hadn't disappeared completely. It had just changed shape. Respect in a military hospital wasn't something people talked about. It was something earned. Usually over years. Sometimes in a single moment when everything was on the line. As the gurney was prepared to move, Reynolds stepped aside to let Harper pass toward the door. A small gesture, but noticeable. She paused briefly beside the monitor, confirming the readings one last time. Then she followed the team out into the hallway. Behind them, the operating room fell quiet again. And for the first time that day, the silence faded. The hallway outside the operating room felt strangely calm. The chaos that usually followed a life-or-death surgery hadn't arrived yet. No rushing footsteps. No raised voices. Just the quiet roll of the gurney as the recovery team pushed the young Marine down the corridor. The fluorescent lights above cast a pale glow across the polished floor. The rhythmic squeak of the wheels echoed softly as they turned the corner toward intensive care. Lieutenant Harper walked beside the gurney for a few steps, her eyes, still on the portable monitor, clipped near the patient's shoulder. The numbers held steady. Heart rate 64. Pressure rising. Stable. Only then did she slow her pace. Behind her, the operating room doors opened again. Captain Reynolds stepped into the hallway. He stood there for a moment without speaking, watching the gurney disappear down the corridor. The two Marines who had waited outside earlier followed closely behind it now, their expressions tight but hopeful. Reynolds leaned one shoulder against the wall. Hospitals had a particular silence after a crisis. Not relief. Not celebration. Something quieter than that. A kind of collective exhale. He had worked in military hospitals long enough to recognize the moment. A life saved. Barely. The memory of the surgery replayed in his mind, the monitor, the hesitation, the moment when everything had nearly slipped beyond control. And the voice that had tried to warn him. He pushed himself off the wall and walked down the hallway. Harper had stopped near the observation window of the recovery unit. She stood with her arms folded lightly, watching the medical staff settle the patient into place. Reynolds stopped beside her. Neither of them spoke at first. Through the glass, nurses adjusted monitors and 4 lines with practiced calm. The Marine's chest rose and fell slowly beneath the blankets. Reynolds finally broke the silence. "You read the pattern fast." Harper didn't look away from the window. "Sometimes patterns are clearer from a step back, sir." Reynolds gave a small nod. He understood what she meant. In surgery, attention narrowed. You focused on the wound, the instruments, the immediate problem in front of you. But sometimes the real danger appeared somewhere else entirely. And sometimes the person who saw it first wasn't the one with the highest rank in the room. Reynolds watched the recovery team working for a moment longer. "Military medicine runs on authority," he said quietly. Harper finally glanced toward him. "Yes, sir. But authority only works when people are willing to speak." She studied his expression carefully. Reynolds didn't sound defensive, just thoughtful. After a few seconds, he continued. "Experience teaches you to trust your instincts," he said. "But it should also teach you when to listen." Another quiet pause settled between them. Inside the recovery room, the Marine shifted slightly beneath the blankets. The monitor continued its steady rhythm. Beep, beep. Reynolds looked at the screen through the glass. Then he turned to leave. Before walking away, he stopped briefly. "Lieutenant Harper." "Yes, sir." "You were right to push." Harper gave a small nod. Reynolds continued down the hallway without another word. The hospital moved around them again, footsteps, distant voices, the quiet hum of machines keeping watch over dozens of wounded soldiers. Harper remained by the window a moment longer. Inside the room, the Marine's heart monitor continued its steady rhythm. A simple sound. Easy to overlook. But sometimes the smallest signal in a room full of authority is the one that matters most. LT different.